my name is Monique and this is my SCC Foley checkoff video. Before I begin, I will go over physician order for patient Cody Taylor, and he would like for me to insert an indwelling Foley catheter related to her urinary retention. And so before I go in room, I will gather my materials, which is my Foley catheter kit, an extra pair of sterile gloves, as well as an extra catheter. And I just want to show my physician order. Okay, now I will go ahead and walk into patient's room. Good morning, my name is Monique. I am your student nurse. How are you doing today? That is good to hear. Okay, before I begin, I am just going to go ahead and look at your wristband. And if you could state your first and last name and date of birth. Patient state's name is Cody Taylor. Cody Taylor. Date of birth is 7/18XX. 7/18XX. Perfect. And do you have any allergies, Mrs. Taylor? And she states she isn't allergic to anything. So what the physician would like for me to do today is insert a Foley catheter. Have you ever had one of these? Patient states she has not had one. So what it is because you're having some difficulty releasing all the urine in your bladder, there is a rubber tube that will go up your urethra into your bladder that will help release the rest of that urine, so it could prevent any other complications with the urine staying in your bladder. Do you have any other questions? Patient states she doesn't have any other questions and she agrees to getting the catheter. All right, so I will go ahead and pull my privacy curtain, adequate lighting, and then get things ready. Okay, so I'm just going to raise the bed to a proper working height as well as put the side rail down. So Mrs. Taylor, we're going to start with some peri care. I'm just going to go ahead and remove just enough blanket off that just your peri area is exposed, and I will place a drape over that.
Instruct patient to raise knees to chest, feet flat on bed, and let thighs rotate outward.
Now I will just lift the corner of the drape to do the peri care, and there's soap and water in this basin. So we will start with the furthest outer labia, closest outer labia, inner furthest labia, and inner closest labia. And this will go in the laundry bin. And then we will do one swipe down the middle, and that will go in the laundry bin as well. Now we will dry patient.
During this time, I locate the patient's urinary meatus.
In the laundry bin, and right down the middle. So now I will empty out this water, just get it ready, put new hot water in just to get ready to use for later use, which will be after we're done to do peri care after the Foley.
Hot water is used because during the time that the water is sitting, it will start to cool down.
And this goes in my trash can. My trash can is too small, so I'm just going to place it over there. Okay, now I'm gonna go ahead and grab the water barrier, which is gonna go under Mrs. Taylor. Being careful just to touch the outer 1-inch corners. Okay, Mrs. Taylor, I'm just gonna have you go ahead and raise up your legs, and then this is gonna go underneath you. So patient raises her legs. And that is placed underneath patient. The fenestrated drape is not needed for this video. These are the gloves. If we were going to use the fenestrated drape, we would place it over the patient's labia, the opening area. Okay, so now I'm going to put on gloves. Okay, so now that I am sterile, I'm going to go ahead and adjust the kit on the tray. During this time, if I were going to do a urine specimen, I will open the specimen container.
You want to make sure that you lubricate the first 1 to 2 inches of the catheter by rolling it around in the lubricant.
Okay, so now Mrs. Taylor, we're going to start with cleaning first. So go ahead and hold.
If 3 cotton balls were present, I would clean furthest inner labia, closest inner labia, and down the middle.
From the furthest outer labia with 1 swipe down. Closest outer labia, one swipe down. Furthest inner labia, one swipe down. Furthest inner labia, closest inner labia, one swipe down. And there should be another cotton swab in here for one swipe down the middle. Okay, Mrs. Taylor, you might feel some pressure. Go ahead and take a deep breath while we start inserting this. Okay. So we're about 2 to 3 inches in, and I see a flash of urine. So we're just going to keep going about 1 to 2 more inches. And I am going to hold here. Okay, so I feel that there is a little bit of a resistance, which is good, meaning the balloon is inflated. So I can go ahead and remove my hand, my non-dominant hand, off of the tube to take that off. Just gonna hang this on a non-movable part of the bed, as well as place a stat lock on the patient's catheter so it doesn't get yanked out. Okay, so this also would go in the trash, but I cannot fit it in my trash. We're gonna just continue cleaning patient, all the iodine that is on. And that goes in the laundry bin. And then one swipe down the middle. I'm just going to snake a little bit down the tube for any lubricant or anything else that got on. That also is in the trash. Now we dry patient. In the laundry bin. In the laundry bin. Okay, so now that we are done with that, I am just gonna go ahead and clean up my mess. So all of this will go into the trash. Wash my hands. And this also, I am going to put on new gloves since I did not take off the water barrier. Okay, Mrs. Taylor, if you can go ahead and lift up your hips one more time for me. Thank you so much. And that also goes in the trash. I am going to remove the drape that was on the patient. cover her back up, put the side rail back up, lower the bed, check the room for the safety. Everything looks good. There's no hazards around patient. And now I am going to document. 14 French indwelling Foley catheter inserted today at 0900. Pericare performed prior to start of the procedure. 10 ml of sterile water inflated into balloon. 650 ml clear yellow urine in drainage bag. Patient tolerated procedure. States, I feel better. Okay, so I am all done.